Hi everyone, welcome back to my YouTube channel where we talk about lifestyle, health, and fitness. This is Dr. Nakumufaya. In today's video, we will discuss polycystic ovarian syndrome and ovarian cyst. What is an ovarian cyst? An ovarian cyst is a fluid-filled sac that forms in your ovaries. Usually there's a follicle that is released every month from your ovaries to allow a woman to ovulate and have her menses. Sometimes when the follicle is produced, it might start having fluids and become an ovarian cyst. Other times, when the follicle releases the ovum, it may remain as a corpus luteum and have fluid inside and accumulate fluid inside, and that will also result in an ovarian cyst. However, there are other types of cysts that may form, and these are more complex. They might have other structures in it, like hair or bones, and this type of cyst usually will need to be taken to theater and removed through an operation, a surgical procedure. However, for the cysts that just form, that are not so complex, the simple cysts like the follicular cyst or corpus luteum cyst, these types of cysts usually go away on their own. So there's no medical treatment that you need to treat or make it go away. They would go away on their own. So these cysts, when they form, usually they cause discomfort and pain in the abdomen, and patients would complain about such when they come to the hospital. And if you're having pain with an ovarian cyst, there's no problem with taking. You can take painkillers. Now, coming to polycystic ovarian syndrome, it's a syndrome where you have ovaries that have cysts, a number of cysts, at least 20 or more cysts in one ovary. That is when you are considered to have polycystic ovarian syndrome. Apart from the polycystic ovaries, you may also experience irregularities in your menses, and this means that you don't have your menses every month. You may be having your menses every 2 months or every 3 months, sometimes even 6 months. And of course, it's not normal. It's as a result of your hormones not being balanced in the body. Also, when you eventually have your menses after not having menses for some time, you may get heavy bleeding, and you may bleed so much, and you may need medical intervention if your HB or your blood becomes low. The other symptom that accompanies people with PCOS is hirsutism. Hirsutism is where you have excessive hair growth. Sometimes it's on the face, it can be on the chest or in the hands, the legs, but you may even have a mustache or a beard, which is not normal for women to have. And that's because you have excess testosterone, which is a male hormone, one that brings about such changes in your body. When you have high levels of testosterone in your body, we call that hyperandrogenism. And so if you have that syndrome, polycystic ovarian syndrome, you may have hyperandrogenism, and you may experience excessive hair growth resulting in hirsutism. The other thing is alopecia. Alopecia is where you lose hair, and you may start losing hair in your head and start having a male hairline. Now, what are some of the causes and risk factors? There is no specific cause for polycystic ovarian syndrome, and it's not known exactly why this happens, but it usually does occur. And some of the risk factors include insulin resistance, because when you have insulin resistance, it makes you it increases your testosterone levels. That's how come you can get irregularities in your menses and hyperandrogenism syndrome, and you may have polycystic ovaries. Obesity is a risk factor for polycystic ovarian syndrome. So the risk factors include obesity, insulin resistance, genetics play a role. If you have a family history of ovarian cyst or polycystic ovarian syndrome, you may also experience this syndrome. So those are just some of the risk factors. So what can you do about this condition, or what's the treatment? There is no specific treatment, and treatment is tailored based on what desired changes you want as a patient. So for patients with ovarian cysts, just a simple ovarian cyst, you would be told to wait and just observe, and maybe you can take painkillers when you have abdominal pain. Sometimes these cysts go away on their own. But if the cyst grows and it makes your abdomen distended, you may be required to go for an operation in theater where it would be removed. Also, for patients who have irregular menses, they may be given contraceptives, oral contraceptives that may help to regulate the menstrual cycles. For patients who have very heavy menses and have lost so much blood, you would need to be put on blood supplements to increase your blood levels, and if the blood has dropped so much, you may need to even get a blood transfusion. For those that have hyperandrogenism, and then maybe they have hirsutism, they have acne. Oh yeah, by the way, acne is one of the symptoms of polycystic ovarian syndrome. Patients who have PCOS may tend to have very bad acne. So for patients that have higher testosterone levels, they may be given androgen inhibitors that may suppress the production or the release of testosterone in the body. All in all, diet plays a role in your overall health, even for polycystic ovarian patients, especially those that are overweight and obese. You may need to go on a diet that is healthy. What I mean by a healthy diet is you can eat fruits and vegetables, right amount of proteins, carbohydrates, and fats, but do not eat an excess of processed foods and foods high in salt and saturated fats. So try to regulate your diet. You can also exercise to lose weight so you do not get many complications that may come with polycystic ovarian syndrome. So what are some of the complications? The complications include, number one, infertility, and this is because of the same irregular menses. Your body is not producing hormones at the right times, so you do not get your ovulation in time. And so you may be trying to conceive, but you are not getting your periods, and so you will not be able to conceive. And that can be fixed by using oral contraceptives to regulate your menses so that you have normal menses and normal ovulations and normal menstrual cycles. The other complication that may arise from polycystic ovarian syndrome is that you may have type 2 diabetes. You may end up having type 2 diabetes because of the insulin resistance that comes with PCOS. You may also get gestational diabetes, which is where you have diabetes only when you are pregnant. The other thing is you may get preeclampsia, which is hypertension during pregnancy. Another complication is that you may get sleep apnea, and sleep apnea is where when you are sleeping, you run out of breath and tend to stop breathing for maybe a few seconds and then catch your breath. You may even wake up and then catch your breath again and go back to sleep. This usually happens to patients who are obese. So if you are obese, then look out for such, and if you need help, you can always consult with your doctor on how best you can manage this type of a condition. The last thing I will talk about is non-alcoholic fatty liver disease, and this is as a result of the same insulin resistance. So your body will start accumulating fat because of the sugars that you're taking in, and there isn't enough insulin, and your body is not responding to the insulin. So you store up fat in your liver and you have non-alcoholic fatty liver disease. So I really hope that this video has been helpful. If you need extra help and you feel you have polycystic ovarian syndrome, you can always consult with your obstetricians, and they'll be able to give you guidance and help you with whatever concerns that you may have. Thank you so much for watching. Please do like my video and share the video with others, and don't forget to subscribe to my channel. Thank you so much. I'll see you in my next video. For now, it's bye.